Everyone is focused on health care, but very quietly, something else ended up looped into the health care bill. What are we talking about? Well, we went to Capitol Hill, and Senator John Thune went on the record. Senator, nice to see you, sir.
Nice to see you, Greta.
Nice to be in your office, too. I don't think I've ever seen your office before.
Well, it's nice to have you here. It's not much to see, but we do have our buffalo.
And you do have your Green Bay Packer helmet.
I do indeed. That's right. I always advertise that.
Okay, now, what happened in the Senate this week? What has been sent over to the House?
What came to the Senate was a reconciliation bill, which is supposed to be the fixer bill for the health care bill. And it contained a number of things, including more revenue raisers, more tax increases, more Medicare cuts to pay for the health care bill. But it also included the student loan takeover proposal, which is something the Democrats have been trying to do, but it essentially takes the 2,000 lenders across the country that are making student loans, pulls it all in, creates 4 federal call centers, and now students will have to go through the federal government to get their student loans. And what we found especially egregious is they took money out of that program and used it to pay for health care. So now students are going to pay higher interest rates on their student loans in order to help finance the new health care entitlement expansion. So that's what we were acting on. That's now been sent back to the House. We offered like 35 or 40 amendments. All of them failed, but we raised 2 points of order that succeeded, that were found by the chair, were sustained by the chair, and so it now has to go back to the House of Representatives to be acted on again.
Why are student loans part of the health care bill? And is it just routine?
Really good question. I think they saw it as an opportunity to get part of their agenda through. It wasn't, we didn't have hearings on it over here. It hasn't gone through regular order. It didn't follow the process, but they saw it as an opportunity to fit it into this reconciliation bill and accomplish something they've been trying to do for some time, which would be controversial if they did it through regular order, because then you'd be faced with the regular amendment process, which would take 60 votes rather than 51. So they were able to get a big piece of their agenda, and essentially what is sort of nationalizing this whole program and taking what are 30 or 35,000 jobs out in the private sector and killing a lot of those jobs and bringing these jobs into Washington, D.C., where these loans will now be originated and processed.
Well, I don't beat a dead horse, and you're the wrong party to talk to, but it is sort of interesting that the education student loans is in the health care bill to most Americans, and the doctor fix, which is the $200 billion, which is to fix that problem for doctors, is not included in the health care bill. That I think most Americans might wonder why that is. Do you want to take a stab at that one, or do you want to pass on that one?
2 things. One is the student loan thing raises revenue for them. I mean, it's the way they do it.
But it may be one thing if it were like, maybe hospital technicians doing extra work and bringing money in or something. I don't know, but.
I think more than anything else, they need to pay for their health care expansion. And they also have that sort of an ideological, philosophical difference about how to do the student loan program. We believe that it makes sense to have lenders out there, these 2,000 lenders across the country, jobs created in the private sector, working with that program. They've thought for some time that the federal government ought to run it. So,
but that's even different. I mean, you have a philosophical difference with the Democrats on whether that should be brought in-house or out-house, essentially, with the federal government. But that's separate and apart from why are student loans part of the health care bill when you're not including the doctor fix, when I think most people would agree doctors deliver health care. I mean, students, I don't know.
That is sort of a given. Including the doctor fix in the health care bill would have put it out of balance. I mean, they're claiming that this has a $140 billion budget surplus associated with it. The doctor fix costs about $290 billion. So if they include the doctor fix in the health care bill, and yes, it is related to health care, it would make a lot of sense to do that, it puts their bill about $150 billion in deficit. So they've sort of, with a wink and a nod, said, we'll take care of this later, the doctor fix, and we're not going to include it in this package because we can then keep it in balance and argue with a straight face, albeit I don't know how with a straight face, that this somehow reduces the deficit.
2 Democratic senators, Senator Stabenow and Senator Landrieu, both have said to me on camera that they thought that, well, maybe it should have been included, the doctor fix. I think many Americans would wonder, like, you sort of lose confidence if you think something's intellectually dishonest. And I'm not saying we should pay the doctors or not. Actually, I think we should pay the doctors. But it's not even a question whether we should do something or shouldn't do it. It's when we see things sort of included that we don't think are part of the issue, and things excluded that we think are part of the issue.
Right. And that's what a logical person would think. I mean, it's just sort of intuitive that if you're dealing with a bill on health care that you would deal with health care matters, and if you're dealing with a bill on education or student loans. And I think that's why the American public is so frustrated and so cynical.
You guys do that, though? You guys, the Republicans do that when you, I mean...
It's not like it's new around here, although this took it to a whole new level. I mean, doing the way that they constructed the process by which health care passed here, both in the House and the Senate, really was pretty unprecedented. When you talk about something that is this large and this consequential in doing it this way. But that isn't to say that in the past that both sides haven't done, attached non-germane things to bills. And but I think the American public this time is paying more attention because it matters greatly to them. And they're starting to realize, we really don't like the way these guys are going about their business out there. And I think all the special deals just adds fuel to that. I think it creates more cynicism and just makes people more disillusioned with Washington, D.C., which is why our approval ratings are where they are. But we have a responsibility, I think, to be transparent and to exercise good stewardship when it comes to people's tax dollars. And what we're doing with this health care bill is anything but that. I mean, this is a budget buster that is going to explode because of all the gimmicks that they've been used to understate its true cost.
Senator, thank you, sir.
Always good to be with you. Thanks, Greta.
Nice to see you, sir.
You too.